Hey guys, so these exercises I'm going to demonstrate here are some exercises that I did in one of my live Zooms where the question was, how do I help to counteract my knee hyperextension? And a lot of times we only pay attention to strengthening our quads, which is at the top of our thighs, and that helps with that extension. But we need to pay attention also to our hamstrings, which is behind our thighs. The hamstring helps us with that flexion. So I'm showing how we're going to focus on bending those knees at a 90 degree. Pull those feet in closer. You can drive your shoulders up, closer up underneath your back if you can as well. And also making sure that you're careful while you're doing this. You may have to have someone assist you to make sure your foot is down. I remember when I used to do these in the beginning of my stroke, I would do it in front of a mirror or always place my feet in front of a wall to make sure my affected foot did not slip out. And I'm explaining here when we drive up, you want to squeeze through the glutes and lift up. You can do this for a duration of time. And a good one would be maybe setting a clock for a minute and testing yourself out to see how many you can do in a minute, and then coming back around will help you to make sure you're actually making progress versus saying, okay, if I gave you a number duration, then you beat yourself up if you may not have successfully got that number duration. So giving yourself some time. And always remember, we have to give ourselves grace with this. So for the moment, I'm commending some of the survivors on their workouts as I'm showing them how to do the workouts. They're doing them with me, so I'm having to pay attention and make sure they're doing them correctly as well. So I'm talking to them. That's why I'm talking to y'all through this voice, so you can't hear the full conversation. And shortly here, I'm going to show you how to do it with a single leg. And I'm explaining I am left side affected, so I want to make sure that left leg is placed down in position. And I'm going to drive up through the left heel and pushing my right leg up. And this isolates to really work on strengthening that affected side a little more, showing how to take my hands and push down into that affected leg to help me with keeping it down. We can also switch legs here. Even though we're working on strengthening our affected leg, we always still want to pay attention to our non-affected side. So that's what I'm explaining here. It may be hard for you to get that leg up, so you can grab that leg with both of your hands to help you to hold it in position as you're lifting up. And I'm still explaining how we drive through the heel and squeezing those glutes. So again, just take your time while you're doing this. Now I'm going to flip over onto my stomach to show them how to do a lying down leg curl. Somebody was doing something pretty fancy here, so I was commending them. And actually, somebody asked if they could put some ankle weights on to strengthen them a little more. And that would be excellent, to put some ankle weights on your legs and help you do this leg curl. And this lying down leg curl, you're driving your heels up towards your butt as far as you can. I want you to focus on slowly moving. And I'm showing how we're working that hamstring area. You see the little bulge. For those of you that have situations that you can't pick up your affected leg by itself, look closely here. I'm going to show you how you would take your non-affected leg and place it up underneath your affected leg to help guide that leg up. So I have that leg right there. We're going to guide the leg up to assist us. And I'm taking my time as I'm curling up because you really want to get that hamstring activated, get that muscle activated here. Driving up and down, but it is still very effective even without adding any weights. Is very effective for you. So test these out. Let me know how they work for you, but definitely we got to remember we need to strengthen all areas of our body to help us with that knee hyperextension. So we strengthen that quad and our hamstrings. We will have better mobility with flexing those legs, meaning we'll be able to walk better, meaning we'll have more mobility with getting on the floor and bending our knees correctly as well.